Hello everyone and welcome to this session. In today's session we will discuss some of the solutions to health information systems challenges in South Africa. This presentation follows on from our discussion last week on the district health information system and some of the challenges that we saw within that system. Slide 1, our objective slide. You will see that the purpose of this session is to look at medical records, but more specifically at electronic medical records. We're going to see why we have medical records in the first place, and then we will focus specifically on electronic medical records. We will discuss some of the features of electronic medical records, and in so doing, we will see that there are a number of advantages in using this form of record keeping. We are also going to look at some of the e-health strategies that have been applied in South Africa to try address the challenges that we raised with the district health information system. Slide 2 is our question slide. Let us start by asking this question. What do you think are some of the advantages and perhaps the disadvantages of electronic medical records over paper-based records? Do you think that electronic medical records are better than paper-based records? And if so, why do you say this? Slide 3, we look at the purpose of medical records. Medical records have a number of distinct functions. First of all, medical records provide a means of communicating between staff members who are actively engaged in managing a patient. If we think about a patient moving through a health system, in many instances, that patient is likely to see a number of healthcare professionals, depending on their condition. We therefore see that we need a single point of access around which all healthcare providers who are caring for that patient can communicate. And that is really the one key function of having a central medical record for that patient. So we see that the medical record therefore acts as an informal workspace that records the ideas or impressions that build up a consensus view over a period of time for that patient. Very useful is having a record that tracks the history of a patient so we can see changes in that patient over time. The patient record is therefore never really the patient's story. It is in fact an interpretation of what medical professionals are seeing of that patient. So we can see it as a point of reflection around which health professionals are able to manage and care for that patient. It forms a single point at which all clinical data are archived and that can be used to track that patient's medical history over time. So one way of doing this, of course, is through a paper file, but another way is to store that information through a computer system. We see that very usefully here, there are many advances in computer-based systems for medical record keeping. Very often we refer to these as electronic medical records, but there are other terms that are used too, such as computer-based records, computer-based patient records, or electronic patient records. Slide 4 focuses on some of the functions as well as the advantages of electronic medical records. You can see from this image that there are many functions within an electronic medical record. For example, we can use a central database to help us manage workflow. Through very carefully crafted algorithms, the system can predict what needs to happen with a patient at different points in time. This can help people to manage their work around that patient. We also see that the system can be used for messaging, sending messages not only to patients but also to and between different healthcare professionals. Obviously, the records can be kept within a central repository. And here also we see that this is useful in terms of patient management, where alerts can be sent out to patients to remind them either to come for a follow-up or to to collect their test information and for other reasons too. Very usefully, the system can be used to store images that are taken, for example, X-rays, that can be kept in one place and are easily accessible by the care provider for that patient, who might want to go back and see what has been taken, what images have been taken for that patient. It's a very useful way of monitoring data. We are able to use these central databases to go through a lot of data to see what is the picture that is emerging around the use of services within a particular health system. Very usefully, this is a central place to order tests, but also to see the results of those tests very quickly, so that a clinician is able to draw up those results while consulting with the patient. So you can see that there are a number of advantages of using an electronic system to store a huge amount of data. One of the first advantages is a practical one. We see that instead of having to have a lot of space available to store many patient files, we can keep a lot of information in a very small amount of space. It's also possible for different healthcare professionals to be looking at the same records around that patient at the same time. Obviously, with a paper record, only one person can have that record on them at one point in time. It's also possible, through an electronic medical record, to use data for a variety of clinical research activities. So here, for example, it's useful to conduct clinical audits of large amounts of data to see, are we achieving the intended outcomes of the health service? It allows us to more easily access data for these clinical audit purposes. The electronic medical record also represents the totality of information and communication systems that could be made available in the support of clinical activities. And we've discussed some of those functions. Further functions also include things like ordering tests or digital image archiving, the exchange of messages between different workers, and also automated coding of patient data for administrative purposes. So it can have both a clinical function as well as an admin function. Slide 5 looks at some of the physical as well as information aspects of computer-based systems. So as we've discussed already, a computer-based system allows for an enormous amount of data to be stored in a very small physical space. And this is, of course, very useful not only in terms of space allocation, but in terms of collating a large amount of data in one repository. It also helps the system to create duplicates or copies of that data, either by sharing data, but really importantly, by making backups for security reasons. So paper-based records are often difficult to duplicate because you wouldn't really want to write something out more than once. And they are also more susceptible to physical damage over time. We find that sometimes computer systems can be very cumbersome and often are a bit rigid in how they are used. Whereas when we think about paper is a lot more intuitive. It's more informal. It's much easier to quickly write something down and to get your ideas on paper as quickly as possible. However, we can see that there are many advantages in different software technologies and new devices that kind of shift this experience of moving computer-based systems to mirror or mimic paper-based systems. Think about a tablet with a pen that you can scribe on. It becomes a much easier way of using an electronic system in the same way that you might use paper. We see that computer-based systems permit multiple individuals to read a record simultaneously, and of course they can do this in different places. So different clinicians could be consulting in different parts of the world around a patient because they will all have access to the same record. Computer-based systems can also protect physical access through a variety of security measures, and this is important in terms of confidentiality and ensuring that authorization is managed around who can access those files and who cannot. We see that there are also a number of information aspects of computer-based systems. For example, they can better manage a large amount of patient records, and they can also manage complex information tasks. So we can see relationships between information points within different medical records. We can see that it also improves the speed of searching through data, and it also allows for complex types of searches. So instead of having to track down one patient file that might be kept in a huge file room, here you can search very quickly and draw up that information. Similarly, you could look within a bunch of patient records to see what kind of information is coming out of those patient records. It helps us to improve the ability of a computer-based database to search according to a number of different attributes. So if you're wanting to look for patients with a particular disease or with particular symptoms, you can do that much easier. And this depends on, of course, how records are indexed. And there are clever ways in which, for example, we can use coding to index what we see within a patient record. Slide 6, we draw a link between some of our previous discussions on models and how models can be used within electronic medical records. So you can see here there's a useful image which shows the link between patient data and the tasks that can be performed through models that are created to facilitate those tasks. So electronic medical records can use models to assist with clinical as well as administrative processes that allow us to interpret data in useful ways. So using models for clinical tasks, for example, electronic medical records can actively participate in the clinical care of a patient. For example, it can assist with generating specific views of clinical data. It can send alerts to clinicians. It can also use models to align with treatment protocols through well-designed algorithms. So when, for example, a patient comes into a consultation with certain signs and symptoms, and a clinician diagnoses a patient with a certain condition, they can use a clinical code that indicates what that patient is presenting with. And following that code, an algorithm can be brought up that can indicate what the clinician should be doing. For example, what kinds of tests should be taken for that patient, what kind of treatment protocols should be followed, how does this link with existing treatment protocols that have been designed around the management of that condition. So to sum up, we see that electronic medical records can assist with in some instances with prescribing, in other instances with sending out alerts and reminders. It also helps with setting tasks around clinical management, and it can help to link up with clinical guidelines. And very usefully, they are useful in conducting clinical audits to see, are we achieving the outcomes that we set out to achieve when patients present with particular conditions? If we follow these guidelines, are patients actually improving or not? Slide 7 discusses some of the e-health strategies that have been designed specifically in South Africa to use electronic medical records in a very productive way. So let's define, first of all, what e-health refers to. The World Health Organization defines e-health as the use of information and information technologies for health to, for example, treat patients, to pursue research, to educate students, to track disease, and to monitor public health. So there are many functions that an e-health strategy needs to focus on. We see that digital health technologies provide opportunities to strengthen our health system. They can transform the way that health services are provided, and the way in which people engage with those services. In South Africa, we've had a number of strategies to try move from a paper-based system into an electronic system through an e-health strategy. In 2012 to 2016, we had the National e-health strategy for South Africa. The aim of this strategy really was to provide a clear roadmap for achieving a well-functioning national health information system. So there was a recognition that the district health information system has a number of challenges and that technology can be used to address those challenges. It also aimed to ensure that the exchange of data between the Health Information Exchange, the HIE, and the central data repository called the National Health Research Database was improved. It also aimed to respond to the political aspect at that point in time, which produced the white paper on national health insurance. So we were discussing at that point in time what a national health insurance would look like. And there was a recognition that in order for national health insurance to work, we need to have a national database with electronic patient-based information systems. Slide 8 is a discussion around the National Digital Strategy for South Africa that followed on from the previous e-health strategy. So we see that there were many implementation challenges with the initial e-health strategy. The plan was, first of all, for individual facilities to have an electronic system so that each facility had computers where patient records could be moved electronically. The second stage was then to link up the different facilities within a district so that if a patient was moving from one facility to another facility, their patient record would be accessible in different facilities. And the third stage was then to link all those facilities at a district level to a provincial level so that could feed into the national information system. And we see that there were many issues with training administrators to use computers in facilities, that often technology breaks down and needs to be repaired, that there are connectivity issues, and we need a whole infrastructure to support electronic systems. So the follow-on from that strategy is our National Digital Strategy for 2019 to 2024. So we're looking into the future. And we can see that there's a very strong vision here to ensure that better health for South Africans is enabled by person-centered digital health. And we see that the idea is that electronic records improve patient-centered or person-centered care, because a patient can move anywhere within the health system and that patient record could be accessed around the needs of that patient. We see there are a number of strategic principles that guide this vision. The first being the patient-centeredness aspect. We have to focus on the needs of people. In doing so, this will be able to assist with expanding access, because a patient won't necessarily be constrained to one facility. They could move anywhere in the country, and that information will be available to them. It allows for innovation that can address sustainable issues, and it also focuses on the workforce, specifically for economic development. And very importantly, the government recognized here, or the National Department of Health recognized that we need a whole government approach. Health does not exist in isolation. We have to engage all different departments, and we need to link these systems up with other departments too. So this led to a range of strategic components. Leadership is obviously key. We need to have clear guidance from people who are leading this directive. We have to engage stakeholders. There are many, many people involved in this process, and they need to be adequately engaged. There has to be a clear strategy, which is outlined in this document, and we need to invest in this form of infrastructure. There needs to be governance of the infrastructure so that money is spent appropriately, and we can account for any fraudulent activity. And of course, this requires a built infrastructure and architecture, and standards need to be set within the system so that there's complete consistency between the different facilities and how information is captured. Slide 9, our final slide, looks at the conceptual overview of this particular strategy, the South African Digital Health Platform. And you can see in the center here that we have a central digital platform that does a number of things. First of all, it helps with terminology to make sure that terminology is consistent throughout the health system and that there is not confusion between what we are referring to for different diseases or conditions. We see that communication is central, that communication between health facilities, between care providers, but also to patients. We have to be able to give information to people on the ground, for example, when they should be coming into a facility for particular tests or for immunization or for follow-ups and so on and so forth. It's also very useful to communicate and send out health promotion messaging to different groups of people who might be at risk. So people with particular conditions or mothers, so on and so forth. Integration, of course, is really important. We're talking about integration across a range of services, not only health services, such as procurement or laboratories, but also with different departments. And we see that it is meant to be a data repository where we can keep a large amount of data in a secure fashion to ensure both patient confidentiality, but also to make sure that patients trust the system. By having all this information in one place, we are able to do much better analytics of larger sets of data, which helps policy planners to know what they should be focusing on. And you can see that there are 4 different categories of people that have been identified that feed into this repository. So we need to design digital health appliances for planners and for managers. They need to have robust and accurate and timeous information to be able to make quick and careful decisions. We also see that there are applications that need to be designed for administrators to help them to run the back end of the health system, particularly around health financing, but also the management of patients. Of course, there's an opportunity here to design digital health applications that assist health workers to do their work. And finally, we see that there is a role here for these applications to be applied to patients, to specific populations, and to build a relationship between patients and the health system. Slide 10 is our reference slide. You can have a look at the key reading for this session, which is our COERA textbook. the Guide to Health Informatics. The information here comes from Chapter 10. If you want any clarity, please have a look at the pages indicated here. And if you would like, you can Google the National Digital Health Strategy for South Africa to see what is the plan that is going to be unfolded over the next few years.